The following videos demonstrate how to operationalize patient-centered counseling about reproductive goals and contraceptive preferences using the PATH framework. This framework is a concrete set of open-ended questions and counseling skills designed to effectively engage with patients about their reproductive goals and, when appropriate, pre-pregnancy care, contraception, and infertility services. PATH is an acronym. The PA stands for parenting or pregnancy attitudes, the T for timing, and the H for how important it is to prevent pregnancy. PATH asks the following 3 questions. For the PA, do you think you might like to have children at some point? Or if the person's already had children, do you think you might like to have more children at some point? The T, when do you think that might be? And the H, how important is it to you to prevent pregnancy until then?
Just before the scene begins, we come into a visit that has already started. Patty asks the first PATH question, and notice she doesn't ask the T in PATH, which is the timing-based question, when do you think that might be? She does this because Mia has already said she doesn't see that happening anytime soon. If she had asked the T question, it would show Mia she wasn't listening. Notice Patty's facial expression when Mia expresses joy at the thought of being a mom. Finally, notice that when Patty asks the last question, H, how important, she includes what Mia had said and asks, how important is it to you to prevent pregnancy until you're married?
So do you think you might like to have children at some point?
Oh yeah, I would love to be a mom someday. But I'm really traditional and family is really important to me. I want to be married first, and I don't really see that happening anytime soon.
How important is it to you to prevent pregnancy until you're married?
It's really important, but things happen for a reason, so if it happens, I'll deal with it.
So since you've said you don't want to be pregnant anytime soon, would it be helpful to talk about options for contraception?
Yeah, that sounds great.
Great.
Patty transitions to offer a discussion of contraception based on paraphrasing what Mia has said, and then asks, do you have a sense of what's important to you about your birth control? Mia asks what she means, so Patty gives examples. If Mia had not asked, Patty would have given her 5 seconds to consider the question before rushing in with examples.
Do you have a sense of what's important to you about your birth control?
I'm not sure what you mean.
For example, some birth control methods are more effective than others. They do a better job at protecting you from pregnancy.
Patty uses a visual aid during the examples. Notice the plain language. Some methods change the way your periods come. Then, after she gives examples, Patty asks a follow-up question. Is any of that important to you?
Some methods have hormones in them and some don't. Some methods will change the way your periods come and others won't. Is any of that important to you?
Yeah, when I was looking at this chart, I was just surprised at how differently they all work. I guess I would want whatever works best.
Patty paraphrases using plain language. She incorporates the patient's priorities until you're married, and then asks, do you have a sense of what else you're looking for?
So you really like something that's great at preventing pregnancy until you're married. Do you have a sense of what else you're looking for?
Something natural, without hormones.
Patty doesn't ask why Mia doesn't want hormones. Patty starts with validation and then respectfully asks for more information. Can you help me understand what is concerning to you about hormones? So if Mia's objection had been based on misinformation, she could have addressed it.
I hear that a lot, and different people have a variety of different things that are concerning to them about hormones, and I'm wondering, can you help me understand what's concerning to you about hormones?
I don't want anything that'll disrupt my body's natural rhythms. I try to take care of myself, and I just don't want to put anything unnatural in my body.
It sounds like you'd really be more comfortable with something that's hormone-free.
Yes. So far, I've been using condoms, but I don't really like how they feel. When I first start dating somebody, we'll use them until we get tested. I know it's really important to protect against STDs.
Patty validates, then gives information, then points out something very positive. You can see Mia is happy that Patty sees her for who she is. Patty then paraphrases, and when Mia corrects her, she is not defensive and welcomes the clarification, thus increasing rapport while further clarifying Mia's preferences.
Yeah, condoms are a wonderful way to protect yourself against sexually transmitted diseases. And it's an example of what you were talking about taking really good care of yourself, that you're so responsible about getting tested.
Been doing pretty good so far.
So it looks like you're looking for a method that has no hormones and that's really reliable. Do I have that right?
Yes, and that's natural.
Right. Thank you for clarifying. And when you say natural?
Well, like you said, some birth control changes your periods, and I like getting my period. I mean, I like knowing what's going on with my body. So, just being natural.
Patty uses a tactile aid which Mia holds while Patty gives only 2 pieces of information.
Well, this IUD contains no hormones, and as you can see, it's up here at the top of this chart that you were looking at, so it's one of the most effective methods that we have. This is what it looks and feels like.
But don't these mess with your ability to get pregnant later? I thought I read that online somewhere.
Patty starts with positive agreement and then goes on to clarify, rather than correcting Mia or chastising her for believing misinformation online. Patty goes on to make a recommendation for a trusted internet source. She gives a personalized recommendation for bed cider, and only then does she explain the correct information.
I think what you're talking about is the shot. And it could take a while for somebody's natural ability to get pregnant to come back after they stop using it.
I read a lot, sometimes too much.
While I'm thinking about it, there's a website that I think you might really love. Since you like to look things up and you like to keep yourself informed, it's called bedsider.org. And it's all about contraception, and the information on there is all accurate. And it's really actually very fun. This chart that you've been looking at comes from that website.
Oh, great. Well, thanks. I'll check it out.
Yeah, let me know what you think. And just to be clear, all the other methods of birth control, except the shot, once you stop using them, your ability to get pregnant goes back to whatever's normal for you immediately. So you've been really clear that you want to be a mom someday, but that it's important to you not to get pregnant until then.
Patty uses the words up to 10 years to emphasize that Mia doesn't have to use the device for any particular length of time. She adds another phrase that underlines the idea that Mia does not have to use it for the full 10 years and emphasizes the concept that she will remove it anytime Mia wants it out. Patty uses plain language with the phrase, "Your ability to get pregnant goes back to whatever is normal for you immediately," rather than saying, "return to fertility," or telling Mia that she can get pregnant immediately.
And this IUD will work for up to 10 years. But if you'd like to get pregnant at any point before that, or if you'd like it out for any reason, just come in and we'll take it out for you. And then your ability to get pregnant will go back to whatever's normal for you immediately.
Oh, I really hope I don't need it for 10 years. I want to be married before then.
Just as long as you know that you can use it as little or as much time as you like, up to 10 years.
Patty offers to discuss side effects, which is something patients want their provider to tell them about. She then gives only 2 pieces of relevant information and then asks a follow-up question. Notice other times when Patty asks a follow-up question after telling Mia something. This is so Mia can digest the information she has been given and she is not overloaded with information. Notice Patty's hand motions as visual aids.
I imagine you'd like to hear about side effects?
Please, this sounds too good to be true.
So because this copper IUD has no hormones in it, as we said, women will continue to get their natural period, just like they would if they weren't using any birth control. Some women may have heavier periods or longer periods or have more cramps. What are your periods like now?
They're normal, I guess. Sometimes I have to use a heating pad, and that helps.
And you've been pretty clear you don't want to use any hormones. And I'm just wondering if you would be uncomfortable using medication if you got a headache or pain of some kind?
I mean, if I need to, I'll take Aleve. Not the name brand, the generic kind.
That medication, generic Aleve, is called naproxen sodium. And actually, if you use it when you get your period, when you're using the copper IUD, it can reduce the amount of bleeding that you get by more than half. Do you usually know when your periods are coming on?
Yeah, a couple days before I'll get a backache, and so that's why I use the heating pad, and my breasts get really heavy and sore.
Patty empathizes before moving on to give more information. Notice that she neither overreacts nor underreacts. Empathy is best displayed without labeling someone's emotions and matching the level of emotion. In this case, there is minimal emotion from Mia, so Patty matches it.
That sounds uncomfortable. Yeah. So the medication that we're talking about actually can also help with your backache and any cramping that you get.
Oh, that's even better.
So if you want to try this, then what I would suggest...
Patty personalizes the instructions to Mia by including Mia's particular premenstrual symptoms. Patty offers to write a prescription sensitive to the possibility that for some people, prescriptions are less costly than over-the-counter medication.
When your period's coming on, and you know that your period's coming on, you can feel your backache, start taking the naproxen sodium. On the package, it'll say 1 tablet in the morning, 1 in the evening with food. Just double that, 2 in the morning and 2 in the evening.
Okay, got it. But is it okay to take that much?
Yeah, actually, that's the prescription dose. And if you prefer, I can write you a prescription.
Oh, actually, that would be great. It would actually be easier and cheaper for me since my prescriptions are paid for.
Great.
Patty uses teach back, but takes the responsibility on herself by saying, "So I've been as clear as I could be," or "To be sure I haven't left anything out," instead of asking Mia to repeat back what she just told her in order to check that Mia heard and understood, which could make Mia feel patronized.
So we've gone over just a ton of information today, and I want to be sure I've been as clear as I can possibly be and haven't left anything out. Can you tell me how you're going to reduce bleeding when you use the copper IUD?